Back on Talk of the Town and bringing in a familiar face as Eric is here from the Medicine Shop Pharmacy in Monona. And welcome back, Eric.
Thanks again for having me back.
Yeah, thanks for coming on. And today we're talking about medication synchronization. I'm going to read it right off the card. I want to make sure I'm doing it right.
A little bit of a tongue twister.
Yeah,
yes.
Medication synchronization. What is that?
Yeah. So it's basically the concept of people that have multiple prescriptions, getting them coordinated so they all come due for a refill at the same time.
Okay.
So instead of having, we have a lot of patients that come in and they'll come in 1 week and they'll maybe come in later that week and the following week, that kind of thing. And, once in a while we get, we're always here, we're coming in, we like to see you guys and, but, is there a way to get them synced up or due at the same time? And so that's basically what the program is to coordinate people's refills so they all come due at one time versus multiple times.
So I always thought that was the trick to get you to keep coming back to the pharmacy. Maybe buy some shampoo or some Vaseline or something while you're there, right?
I'm never going to not advocate for that. But as far as prescription goes, it also is important for compliance and making sure people are taking their medications so that things don't get lost in the shuffle or the fray. So,
but besides time saved for the patients, how is it beneficial for them to have it all synced up like that?
So obviously time saving is the big one.
Right.
But then again, I kind of mentioned that it allows them to kind of not have to worry about whether or not they're missing a medication, that they forgot about one. It also allows them, for a lot of insurance companies these days, they allow for 3-month supplies to be filled at a time. And it's sometimes hard for pharmacies to keep that kind of stock, on their shelves at all times.
Sure.
And so it allows them to not have to come into the pharmacy and maybe pick up a portion of that 3-month supply and then have to come back again for the other portion that the pharmacy didn't have. So it's a big time saver for them, and then it kind of takes some of the coordination away from them and puts that more on us.
So the benefits for the pharmacy, so already we got like an inventory kind of benefit.
Yep.
How else does it benefit the pharmacy then to do it this way?
For us also, again, we get graded on our compliance. There's a big push in pharmacy these days to not necessarily reimburse off of quantity of prescriptions, but there's more of a push and a trend going to quality of pharmacy. And what that means is making sure that people are taking the right medication and they're not missing doses, because those missed doses and taking the wrong medications may lead to hospitalizations or other medications. And so it kind of ensures that the medications that your doctors are prescribing, that you're staying on and staying on appropriately. And then also for us, again, so you're not coming in and having to wait a long time when you drop off your refills. Those refills are done for you. So that makes our job a little bit easier to have kind of that workflow issue where the prescription is filled ahead of time, it's done. When you come in, all you have to do is come in and pick up your prescription. It's all taken care of for you.
Now, do you try to get patients to do this automatically, or do patients have to enroll? How do they get started with the whole thing?
They have to enroll. It's
Okay.
not something that we automatically do for them because, as you can imagine, if you do start a medication mid-month, there are some situations where we have to fill a prescription for a 2-week supply to get it lined up with everything else. Once in a while, there is a slight, cost associated with that because you might have to pay an extra copay during that month while you're getting them synced up. So it's not something that we automatically do. It's something that, yes, you have to enroll in and accept the program. So.
Okay, so you talk about, there could be some kind of either like an overlap or something like that, so there might be an additional copay. Is there any other cost associated with the program? Like if I say, hey, I want all my medications synchronized here, do I have to pay an extra fee to have that happen?
We do not do that.
Okay.
That is not part of our program. The program itself is completely free. You just pay your copays like you would when you come into the pharmacy to get your refills anyway. So for us, our program that we have at the Medicine Shop is completely free. All you pay for is your medications.
Terrific, and so it definitely sounds really beneficial, if you are someone that has multiple, prescriptions that are out there. How about any pharmacy? Does any pharmacy out there do that, or is it just you guys at the Medicine Shop doing this?
I would always check with them. In other segments, that we've had over, the course of these shows, I can always say what Medicine Shop has available. I think a lot of pharmacies do because, again, it benefits the pharmacy as well as it benefits the patient. And so it's kind of a service level issue. So I would definitely check with your pharmacist if you don't come to the Medicine Shop to see if they have something like that in place, and then you can get signed up on that that program that they have.
Everybody likes win-wins. You always seem to be looking for that win-win situation for everybody.
Absolutely.
Yeah, so good stuff. Eric, thank you so much for joining us. Medicine Shop Pharmacy in Monona. Go ahead, check them out. Say hi to Eric when you do, and we'll be back with more Talk of the Town right here on Channel 57.